Welcome to the first week of Free from Falls Online. This week's program focuses on the frequency of falls among people with MS as well as risk factors associated with falls. After completing this module, you should be able to understand the frequency of falls and the impact of falls on people with MS. You should also be able to describe the risk factors that can contribute to falls for people with MS. So let's get started. First, let's talk about multiple sclerosis. Multiple sclerosis is the most common immune-mediated neurologic disease among humans. It affects more than 400,000 people in the United States and millions more worldwide. MS is a condition where one's own immune system causes damage to the brain and the spinal cord, both of which make up the central nervous system. In MS, damage to the myelin, or the outside covering of the nerves, in the central nervous system, as well as the nerve fibers themselves, interferes with the transmission of nerve signals between brain and spinal cord and other parts of the body. This disruption of nerve signals produces the primary symptoms of MS, which vary depending on the specific areas of the nervous system in which the damage has occurred. It is associated with a wide range of symptoms that can affect all major parts of the nervous system, many of which are involved in mobility, balance, and walking. Over the course of the disease, some symptoms will come and go, while others may be more lasting. The severity of symptoms varies widely from person to person. As a result, people with MS are at significant risk of falling. Studies have shown that approximately half of middle-aged and older individuals with MS experience at least one fall over a 6-month period. These studies have also shown that there are several factors that pose an increased risk of falls. Some of these factors include being male, having problems with balance, having problems with thinking, increased level of disability, having problems with bladder function, including increased frequency or urgency, the use of a mobility device, including canes and walkers, and having an underlying fear of falling. The impact of falls on people with MS is substantial. They often result in injuries, such as fractures or head injuries, often leading to emergency room visits and increased cost of medical care. Falls also are often life-changing, increasing the level of disability and dependence on mobility aids. Finally, falls can contribute to the fear of falling, particularly in unfamiliar or public places. This often leads to limiting one's activities and possibly social isolation. There are also several symptoms in MS that can contribute to falls. Difficulties with walking are among the most common mobility limitations in MS. These problems are the result of several factors. The first we'll discuss is muscle weakness. Muscle weakness is a common cause of gait difficulty. Weakness can cause problems such as toe drag, foot drop, trunk leaning, or swinging a leg out to the side to take a step. Weakness in one extremity, for example, within the quadricep muscle, can lead to knee instability and cause a fall. Weakness can often be compensated for with the use of appropriate exercises and assistive devices, including braces, canes, and walkers. Muscle tightness or spasticity can also interfere with walking. Spasticity refers to the feelings of stiffness and muscle spasms. It is one of the most common symptoms of MS. Spasticity may be as mild as the feeling of tight muscles or may be so severe as to produce painful, uncontrollable spasms in the extremities. Spasticity may also produce feelings of pain or tightness in and around joints and can cause lower back pain. Although spasticity can occur in any limb, it is much more common in the legs. In addition, spasticity can also be experienced in the midsection or chest area, limiting the range of twisting motion. When spasticity is present, a great deal of energy must be expended in walking. This minimizes the ability for mobility. Stretching exercises and antispasticity medications are generally effective in treating this symptom. Balance problems typically result in swaying or a drunken type of gait known as ataxia. Using an assistive device such as a cane or a walker can be beneficial for those experiencing severe ataxia. Dizziness can also occur in MS. This may appear as the feeling of being off balance or lightheaded. Much less often, there is also that sensation that your surroundings are spinning. This condition is known as vertigo. Numbness and other sensory disturbances are often the first presenting symptom of MS. Numbness can make it difficult to be aware of the position of your feet or other parts of your body in space, and this may make it difficult for you to walk on uneven or unstable terrain. Finally, tremor, or the back and forth movements of your extremities or the head, can occur with MS. It is often associated with problems of balance and coordination. Fatigue is one of the most common symptoms of MS, occurring in more than 80% of people with the disease. Fatigue can be significant, often interfering with your ability to function at home or at work. This may be the most common symptom for those who otherwise have very few limitations in daily activities. MS fatigue is commonly described as a feeling of exhaustion or being wiped out, with reported worsening in the mid to late afternoon that is unrelated to your level of exertion. When present, it can worsen all of the other symptoms that contribute to walking difficulties. An increase in core body temperature can be caused by conditions such as hot weather, high humidity, hot baths, heated swimming pools, physical exertion, or fever. This increase in core body temperature can slow nerve conduction and temporarily worsen MS symptoms. When overheating causes a worsening of symptoms that lasts for a day or more, it may be referred to as a pseudo-exacerbation. These symptoms typically return to baseline when body's temperature returns to normal. This usually takes only an hour or two, but sometimes symptoms can last for more than a day and may be confused with a true MS exacerbation. Difficulty with vision is often the first symptom of MS for many people. The sudden onset of double vision, blurring, poor contrast, loss of peripheral vision, or eye pain can be terrifying, and the knowledge that vision may be compromised can make people with MS anxious about the future. Pain is a very common symptom in MS. In one study, 55% of people with MS had occasional or episodic clinically significant pain, with almost half experiencing chronic pain. Pain can result from the damage to nerves in the central nervous system, which is referred to as neurogenic pain. This type of pain may be felt as tingling or burning. Pain may also result from altered gait patterns or the inappropriate use of assistive devices. This is referred to as orthopedic pain. The term cognition refers to a range of high-level brain functions. Cognitive changes are common in people with MS, with approximately 50% developing problems with cognition during the course of their disease. Cognition includes the ability to learn and remember information, organize, plan, and problem solve, focus, maintain, and shift attention as necessary, understand and use language, accurately perceive the environment, and perform calculations. A person's ability to use mobility equipment correctly may also be compromised by cognitive problems, and many of these changes can lead to the risk of falls. While bowel and bladder symptoms don't directly affect mobility, this dysfunction may cause an individual who has urgency and frequency issues to rush to the bathroom, to get up frequently during the night when drowsy, or otherwise be attentive to fall hazards. People with MS may be taking a number of medications to manage the disease process and their MS-related symptoms. A range of medications and drug interactions may increase the likelihood of a fall. It is important to recognize that all medications have side effects and that everyone responds differently to specific medications. Fatigue is a common side effect for many medications. Check the labels of your medications and talk to your doctor or pharmacist about how they might affect your mobility and safety. There are several medications used among people with MS that can increase the risk of falls. One medication, Ampyra or dalfampridine, is commonly used to improve walking speed in people with MS. Improving walking speed may lead to overconfidence or less attention, leading to tripping, loss of balance, or falls. Many medications commonly used for pain may promote sedation and thus increase the risk of falls. These include pain medications such as Tegretol or carbamazepine, Neurontin or gabapentin, Dilantin or phenytoin, Cymbalta or duloxetine. Medications that treat tremor, another common symptom of MS, may also have the same effect. These medications include Klonopin or clonazepam, Inderol or propranolol, and Mycilene or primidone. Other medications used to treat spasticity may also promote sedation, but can also increase weakness, hence contributing to the risk of falls. These include baclofen, Valium, or Xanax. Antidepressants such as amitriptyline, fluoxetine, and sertraline may cause dizziness, which may itself increase the risk of falls. There are also several behavioral risk factors that can contribute to an increased frequency of falls. A sedentary lifestyle or inactivity can lead to deconditioning. Inactivity can result in the loss of muscle tone and disuse weakness that is not related to demyelination. Other consequences include poor postural alignment and trunk control, decreased bone density and resulting increased risk of fracture, and shallow, inefficient breathing. Exercise decreases your risk of heart disease, decreases your resting blood pressure, helps with sleep, strengthens bones, increases flexibility, endurance, and energy, and can elevate your sense of well-being. Although exercise does not appear to slow the progression of MS, it can help decrease the complications that arise from muscle fatigue, weakness, contractures, and spasticity. Additionally, a targeted exercise program and physical therapy can be effective in helping to reduce falls and fall-related injuries. Falls and injuries caused by falls can be frightening. Fear is a natural and productive response that keeps us away from dangerous situations. The most common response to fear is avoidance, which can lead to severe activity decrease and disengagement. A person's level of confidence can decrease as MS progresses as well. When activities become challenging, it can cause people to give up those activities altogether. Conversely, some people with MS may simply accept the fact that falls are a part of their lives and continue to perform activities as they always have. They may have a false confidence in their abilities that can be dangerous and lead to serious falls. False confidence can also occur on a seemingly symptom-free day. Often on days where fatigue seems to be managed and good balance is experienced, many opt to leave their mobility devices behind. This can lead to dangerous situations where one might be forced to engage in risky maneuvering or be stranded far away from assistance. It is best to plan ahead for worst-case scenarios rather than assuming how you feel at the start of the day will be the same at the end of the day. Without the proper devices, your mobility problems are likely to interfere with your participation at home, work, in family, social, and leisure activities. Most importantly, this may increase your risk of falls. Those individuals with MS requiring the use of mobility devices have already a higher risk of falls, but this risk increases dramatically when choosing the wrong device. Also, it increases when going without the device and if the device is used improperly. There are a large number of assistive and mobility devices currently available on the market. Your healthcare providers can help evaluate and prescribe the device that best meets your needs. Once you receive your device, it is important that you are trained and fitted for that device to ensure proper usage. Finally, there are several environmental risk factors for falls. Many injuries happen at home. When you identify home or environmental hazards as a potential cause of falls, you should take steps to modify and eliminate them. Eliminating hazardous conditions such as clutter or poor lighting and adding additional supportive features such as grab bars or handrails in locations such as stairs and bathrooms are important strategies in fall prevention. There are also many situations in public places that can make it difficult to maintain your balance and that could cause slips, trips, and falls. Most falls can be prevented with general precautions and safety measures. The best way to prevent injuries is to have a greater awareness of the outdoor environment and to focus your attention on navigating situations that might lead to falls. Although completely eliminating falls among people with MS is unrealistic, a significant number occur under predictable circumstances that could be prevented by identifying the key risk factors that contribute to this increased risk. Afterwards, one would implement appropriate follow-up interventions to reduce this risk. This program addresses falls through a multidisciplinary, multifactorial approach. It combines medical, behavioral, exercise, environmental, and educational components, as well as community resources to support the needs of people living with MS. Over the course of 8 weeks, this National MS Society's Free from Falls program strives to increase your knowledge of fall prevention and help you adopt strategies that will decrease your risk of falling. Each week's program will have 2 parts: an educational component focused on awareness of issues related to falls, and an exercise component directed to improving postural alignment, balance, endurance, and mobility.